change the setting that you currently. Okay. Time on. Muhammad, let's start. Now you can start.
Hello, hello, Mr. Sarah. Hello, Mrs. Sarah.
Hello.
I am Dr. Iman Abdelgader, one of the surgical doctor. I am sorry you have not been contacted before, and I'm here to talk to you about your child condition. Could you please tell me, first of all, could you please sit down?
Okay, so you started your conversation by giving orders and by asking questions, doctor. You are not the one who is supposed to ask questions. I'm the one who need answers. I'm the one who is supposed to ask questions. All right? So what's going on? What's going on?
I understand this must be so difficult for you, Mrs. Sarah, but please could you sit down so we can continue?
Okay, listen, doctor. Listen, doctor. That's not how it goes. You can't just start by giving orders fast and left. Tell me what did happen.
I will tell you everything about your child condition. I'm here to help.
I don't think you're gonna tell me nothing, doctor.
I'm here to help.
I don't think you are aware of nothing, doctor. It seems like you understand nothing. It's quite obvious for me. I ask you a simple questions. What happened? Where is my son?
Mrs. Sarah, I'm afraid I cannot proceed unless you sit down. I'm not ordering you. I just
okay. Don't proceed then.
Discuss.
Don't proceed. Don't proceed. Why are you saying this way? You're so bossy. You're so bossy, and you're so like aggressive. I cannot proceed. Okay, don't proceed then. It's not my problem.
I'm really sorry. I'm really sorry for that, Mrs. Sarah. I'm here to help. I'm here to help.
Okay.
I just want to talk to you about
I sat down now. Okay. Now I'm in the chair. Tell me what happened.
Okay. Your child has been brought here to our emergency department, and he injured himself. He had some injury in his belly, and he has been taken to the operation theater to take care of these injuries.
Okay, please, doctor. From now on, let's have a condition. I don't want you to talk too much, please. I know doctors are very talkative. Can you let me speak, please? How did he get the injury?
Okay, according to his father, he was playing.
Oh my God, his drunk, abusive father. What do you mean according to his father? And did you believe that man?
All right, his father told us he was playing in his climbing frame and he fell down.
And like naive person, you just believed it, right?
Mrs. Sarah, all we care about now is your son to be healthy and to get well. Then we are going to sort all that, Mrs. Sarah.
All right. So who determined that he needs a surgery and who took him immediately to the operation? Did you do any investigation before that?
All right. His father called an ambulance. They brought him there, and we did some scan to his belly. And this scan showed out that there is a ruptured spleen.
Spleen? Spleen?
Spleen.
What the heck is that?
Spleen is an organ. It is found here below the ribs in the upper left tummy. I can draw it for you. The problem with this organ, it has a capacity to take a lot of blood. So when it ruptures, there will be bleeding in the tummy cavity.
Oh my God! So that's a serious So he's a serious condition, right?
Mrs. Sarah, unfortunately, yes, ruptured spleen is a serious condition. But I need to assure you that he is.
What did you say?
He is in a very good hands.
Yeah, a hand that will take him to the hill.
Mrs. Sarah, our consultant is a very experienced, qualified consultant. He is going to take a very good care of him. He is operating on him right now to fix.
Let's pray for that. Let's pray for that. Otherwise, I will take all of you to the court, including his drunk, abusive dad.
All right, Mrs. Sarah.
So his father is abusive and alcoholic, and I really want to protect my son from his dad.
Okay, Mrs. Sarah, does his son is his son injured himself before when he was with his father? Or anything
No.
happened before?
No, nothing like this happened before.
All right. Okay. This is very important information you are providing right now. Our priority is to take care of your son. So we need to do some standard procedure regarding that. We are going to involve the child protection consultant and also the child protection services to make sure
Okay,
that your son is having a safe environment in his home.
Okay, and what will happen after this operation?
All right. We
How
need
many
to make
hours
sure
will take this operation first?
I understand, Mrs. Sarah, this is a lot to take on, and I understand
You
this
understand
happened
nothing,
all of a
doctor.
sudden. So I'm afraid that we cannot determine an time for this operation as it an emergency. The time will be according to what they will going to find in and what they are going to do. So
Okay, and what will happen after the operation?
okay, after that we are going to take him to the recovery. We need to make sure that he is doing a good recovery, and I will make sure to update you when he is out so you can see him.
So when I can see him, when?
As soon as he is out of the operation theater, I will come and update you about that.
You better do that, doctor. And what about, like, does he need any medication?
Yes, about that, we need to make sure that he is recovering well, and after that he will be vaccinated. We are going to give him a vaccine 2 weeks after this procedure. And
Okay.
he is going to take some antibiotic for a long term as this spleen function.
What do you mean by what do you mean by a long term? What exactly do you mean by a long term?
All right, it may be for years, but we
For
are going to
years.
tell you all about that after we make sure that your child is safe and he is recovering well.
But who
We
will
are
determine
going-
is it 5? No, look, doctor. I had agreement with you in the start. I don't want you to be any talkative, please. So you said he will have his antibiotic for years. How many years?
Probably until he is 16, but the medical team will talk
Until
to you
he's what?
about
Sorry? Until he's what?
until he is 16 years,
16. Okay.
probably. But the medical team will talk to you about that, Mrs. Sarah.
Okay, when I will take him home?
All right, we need to make sure that he is recovering well, and we are going to do a series of blood investigation and scanning to make sure that he is doing well, and after that you can take him home. But also
when
after
exactly is that? Like, that's not an answer.
I'm afraid that I cannot give you an
You can give
exact
like, okay,
day.
so you're so useless. What's your job then? You're not answering nothing from what I'm saying.
It depends on how he is doing, Mrs. Sarah. We need to make sure he is doing well.
Okay, and okay, so when answer the question, doctor, please.
I'm afraid that I cannot give you a specific number of days. It may be days, it may be weeks, according to his condition. Will be after we make sure that he's doing well. It is our first priority, Mrs. Sarah. We make sure that he is safe and doing well and can go back to his normal daily life. Also, we need to make sure that his GB is involved about his the future plan of care and his follow-ups.
All right. Okay. Fine. Fine, doctor. What would I say?
I understand this must be difficult, Mrs. Sarah, and I'm really sorry.
And you made it
Time
more difficult.
finished. Time finished.
Time finished. Good. Good, Iman. Okay. Muhammad, I will let you start and then I will follow up with you. Muhammad.
I think she covered any questions. Well, good answer.
Yeah.
But when she start, Iman, did you apologize for the patient?
Yeah, I did. She was so aggressive. And
No. You saw nothing, by the way. What happened? Look, now I'm very I knew if I dealt with you the same way the patient was dealing with me, you will fail the station. She was more aggressive than that one, and she will be more aggressive than that one. That is one.
Also, I have a point in the duration of the antibiotic. You
Just
answer, I
prepare
think,
yourself. The patient will be aggressive more than this. Yeah, Muhammad.
I think you answer the patient need 1 year or 3 years or after 16, something like that.
Yeah, I was just revising the guideline. Some people say 1 to 3 years, some say 1 to 2 years, some say for long life. So I need to consult
Yes, but the
a
best
consultant.
answer, if she didn't know, I will call my consultant and I will come back to provide you by the definitive information and used information and updated.
Yes, but we need an answer for this question. There's difference in the guideline. Does anyone aware 100% of the answer?
From my background knowledge, I think it was until 16 if the patient is less than 16. If he is more than 16, it will be for life. I'm not sure.
That's what they told us in the. I remember that when I was medical student. But there is a new guidelines. There is a nice guideline. Okay, we'll look that up. We need to make sure. I will call the infectious control consultant here and see the answer exactly. But the status answer you should say, he may require the antibiotic for life, but probably we need it from 1 to 3 years. And there is a specific doctor who will determine this. We will consult him and ask him after he recovers. Okay? So the answer is some patient could have it for long life. Some could have it from 1 to 3 years. Who will determine that? Medics, the medical consultant.
Medical. Okay.
All right?
Okay.
Also, Ali?
Yeah.
She said, I will not proceed. I think if you didn't sit.
Yes, that was a wrong sentence.
Yes. You need just to apologize and ask the patient to sit by a fine way.
Yeah.
If
he
didn't accept that, then continue by your consultation.
Yes. If, let's say, your examiner is aware of what's happening. You ask me once, twice, third, fourth, and I don't want to sit, that's okay. You made it clear to the examiner that you want your patient to sit down.
Should I sit or
continue
the consultation while I'm standing?
No, let's say you wasted 2 minutes to convince the patient to sit and the patient don't want to sit. Will you stop your consultation because the patient is standing?
Yeah, I know I should proceed, but should I sit down myself or complete when I'm standing?
Always put yourself with the level of the patient. That's the general guidelines. If we have a patient here on chairs, we will, if the patient is sitting in his chair, I will be kneeling down. So always keep your head with the head of the patient. That's the criteria. If the patient is standing, you're going to stand. The patient is lying down, you're going to sit. The patient is sitting, you're going to sit with him, okay?
Okay. And if in the middle of the conversation, she standed again, should I stand with her?
Okay, no. You just ask her, okay, Miss Juliana, can you please sit down? Can you please let's continue our conversation? She's gonna sit down. But if she refused, you can ask her again. If she refused, then you can stand. Because you cannot talk like this and your patient is standing. That's inappropriate.
Okay.
But probably this all could happen on the exam. This is one of the most difficult stations.
Yes,
you need to practice more and more.
Yes.
But as a whole, your exam is on all.
Is it pass or fail? Yeah.
Pass, of course. You answer all questions in a perfect way.
Yeah, and I want to add another. I want to add a last point. Let's say if your patient was not progressive with the consultation, you are the one who's supposed to progress the conversation. If the patient stopped or forget for anything, you should regarding his antibiotic, he will need antibiotic maybe for life, maybe for a couple of years.
Yes, it's okay. Ali. She ask you, you tell her that I finished. What happened after this surgery? She need to tell you about the medication that you need to use
Yes.
after surgery.
Yeah, that's what I'm saying. Even if your patient didn't ask you directly, you are aware of the question. You know the question. Probably you are memorizing the question. You need to progress. You need to push the patient for the next question. Okay? And if he didn't ask, you answer. In a way, you make it very fluent. Okay, Miss Juliana. After this operation, probably you need to be aware of his antibiotics. He may need antibiotic for life or he may need it for a couple of years. This will be determined by a special consultant.
هاي المفروض نغيرها تعاكلت.
Okay? This will be determined by a special consultant.
ممكن تغير.
Okay. Should we go to the next, Muhammad? Muhammad.
Yes, OGD with Selma Manna.
OGD. Salma Man. All right.
Yes.
Are you ready, Selma?
Hello.
Yes.
Yes.
I think Sahar, she want to
Yeah.
be the patient.
Yes,
Sahar?
I offer to be the patient. Assalamu alaikum.
Wassalam.
Oh, salam. All right. Let me put the time on 9 minutes. So Muhammad, when you are not talking, you can mute yourself because your background is quite obvious.
Okay.
I'm so sorry.
Yeah, Muhammad Babi.
You talk with me, Muhammad Hassan.
Yeah, 9 minutes. You just open your unmute yourself when you're talking. Okay, start.
Hello, Miss Sahra. I'm Dr. Salma, one of the surgical doctor. I have been asked to talk to you about your investigation. We would like to arrange for you. Can I ask you, do you know so far about this?
Hello, Dr. Selma. I'm sorry, I don't know much about this. All they said is they're going to fix my drooling, but I honestly don't know much.
Okay, let me explain to you. Is that okay with you?
Yes, sure, go ahead.
Okay, that we call esophageogastroduodenoscopy or OGD. That is the camera called endoscopy that we insert it to through your mouth to your food pipe to see what is the cause of the narrowing, and then to your stomach, and then to your first part of a small bowel. Okay, the camera will realize it in the screen and show what happened inside you, and we shall make a widening in your food pipe, the narrow in your food pipe, and take a sample for biopsy, and that is make a further investigation to figure out what is the cause. Okay, may I clear, Ms. Sahar?
Yes, this is very clear and helpful. Thank you, Dr. Selma. But I need to ask you, does this cause pain? I'm afraid it's painful.
Okay, that is nice question. This will be typically under sedation, and the sedation make you some drowsy and feel no pain.
Is there any
Okay.
complication for this, Dr. Selma?
Complication?
Yes.
Okay. You know that no procedure without complication. There's mild or simple complication, and there's a serious complication. There may be cause injury to your teeth when inserted the endoscope. Also may cause infection like chest infection, and also bleeding from where the site we take the sample. Also, there is a serious complication like cutting through your food pipe, and this may require surgical repair.
Oh my God. No. This is enough to push me away. I'm sorry, count me out. I'm not going to go through with this.
Okay, miss, I understand your apprehension, but this is that risk does not mean that may occur. We doing my opinion. You do this investigation to rule out the cause of your food pipe narrowing, and this procedure done by the experienced and skilled surgeon. Okay, don't worry.
I'm happy to know, but I'd like to know why is there so much saliva? I cannot be carrying a tissue everywhere I go.
I'm so sorry for that. This the cause from your food pipe narrowing, and that disrupt your saliva downward as normal.
Is it serious? Like, is it cancer? Could it be
Uh,
cancer?
Okay, Ms. Sahar, it still is too early to confirm that. After the result, we discuss that cancer or not, and we will do more investigation to confirm that.
And when can I
Okay.
expect the results to be out, doctor?
Okay, the result will be after 2 weeks, and if available, I will call you and inform you as soon as possible. Okay, Ms. Sahar?
That's very helpful. Thank you, Dr. Selma.
Thank you. Do you have any question or any concern about your condition?
No, I think I'm comfortable now to go for it. Thank you.
Thank you. We will summarize that, Ms. Sahar. And also, I want to confirm our sign for the consent for doing this OED. Okay.
Yes, I was just going to ask. I was just about to ask, are there any papers I need to sign before doing it?
Okay. Summarize this. We need to carry out investigation OGD, and this done under sedation, and this is the possible the risk and complication for this procedure. And now you sign the consent if you are agree.
Yes, I do agree. Thank you.
Thank you, Ms. Sahar. Also,
Dr.
I will
Selma.
add to you, I'm all here to support you and help you and dive your hand at any time. If you have any question and inquiries, don't hesitate to contact with me. I will leave my phone number with the nurse. Okay?
Thank you so much. That's very helpful.
Thank you for understanding. Thank you.
Good, good. There's just one question Imam forgot to ask you. Do I have to stay in the hospital, doctor, while I'm waiting for the results?
Is it Selma?
Salma,
Okay. Yes.
do I need to stay in the
No.
hospital waiting for the result?
We will charge home after you regain your full consciousness in couples of hours, about 2 to 4 hours, and also need someone accompany with you and not drive alone to home. And this structure we will do after you regain your consciousness.
All right, thank you. So as we said, good presentation, very good level. I was thinking Iman intentionally didn't mention it for you so you can push forward. So if your patient forgot to ask you a question or a very important point, even if it was not asked for you, you can mention it. Let's say Iman didn't ask you, do I need to stay in the hospital? And you know that you should address this point, then you need to address it. You should tell her, I'm just confirming for you that you don't need to stay in the hospital while we are waiting for the result. Okay? So if you know the question and your patient forgot to ask you, then you push forward and you give the answer anyway. Your presentation from clinical point of view is fantastic. But I think, Selma, you need to work on your fluency. You have to be more faster.
Okay.
You have to be faster. There's a couple of mistakes, but they are minor. You can solve them by continuing practicing. At the start, you said, I have been asked, and this is not wrong, but we never say that. For example, if I'm going to speak to the patient right now, I will not tell him I have been asked. I will tell him, hello, Mr. John. My name is Ali. I'm one of the vascular doctor working here. And today I came to discuss your investigation. We call it angioplasty. Are you happy for me to proceed? Yes. I'm not sure if you took a consent or no. Muhammad and everyone here, did she take permission to speak about the investigation, or she immediately asked?
She took permission
She took the
after
permission.
she asked it.
She took
Yeah.
permission.
But she took it later. Let's say you want to
Yeah,
speak
just-
with...
No, at the beginning
Before-
she asked me.
Yes, but she didn't ask about the patient name or confirm it.
Okay.
Yes.
This is the most important
Yes.
point.
So
During
don't
your
forget
conversation.
don't forget the basics, the confirmation, the introduction of yourself, the consent. Maybe I have OGD, but I don't want to talk now. Maybe I'm upset. Maybe I'm like someone died in my family and I don't want to speak. Okay?
Okay.
So you have to take consent. You have to take consent. Maybe I'm not ready.
Ali,
Maybe I want to go to the toilet.
she took the consent.
Yeah, I
she-
know. I'm just confirming the point,
Okay.
because when I used to practice in this station, you may think, okay, the patient is already waiting for me to speak. Then I will speak immediately and discuss it with him, thinking that I'm giving him a favor. No, you need to take permission also. You said, can you say require for me, Selma?
What?
Require.
Require?
Yeah. Can you pronounce it? Require. This
Require.
patient require a test.
Better require test.
This patient require, okay. Do I have to stay in the hospital? We already, yeah. You said we will charge home. We will charge home instead of we will discharge home. Did you notice that?
Okay.
Yeah, instead of we will discharge, you said we will charge. Charge, that means taking money from someone.
Yes. We'll discard.
Yeah.
We'll discard. Okay.
Discharge. Yeah, okay. So what you need to do, you need to open a school and open your phone and record yourself. You record the station from the start till the end scenario. You are asked to, with counseling a patient who has till the end. After you finish, listen to yourself and see your mistakes. All right?
Okay.
But otherwise, you're doing good. Your
Ali?
exam is in August.
Yes.
Yes. August.
All right.
Yes.
Selma,
Yes.
Muhammad?
I remember Sahar told you about the consent, which here is crucial to ask about the consent.
Yes.
At the end of your explaining the patient condition and his investigation, tell him
Yes.
about his informed consent.
Yes. So she told you, okay, give me the consent, and then you ask her question, or you didn't emphasize. You said, okay, this is the consent, but you need to say, okay, Juliana, this is the consent. Can you please sign? Make the examiner aware that you asked and you provided the paper for the consent, and you completely consented the patient. Okay.
Okay.
Also-
When Sahar asked me to consent, I give her the consent. Is that okay?
Yes. Yes,
You
of
need
course.
to told her that you need to consent.
Yes.
Yes. Also, I have a point, Ali.
Yes.
I have my friend Ahmed Sufyan told me when his station is OGD, and when
Yeah.
he said that we need to do widening of the narrow bar, the stimulator didn't accept the word.
Widening.
Yes, and he said you mean stretching of the foot pipe.
Okay.
I don't know what the difference between widening and stretching.
Widening. I think it's like from language point of view, it's better to use dilatation, right?
Stretching.
Okay. Use stretching instead of widening.
Yes.
Stretching is better. Better like
Yes,
than
yes.
Yeah.
widening.
Yes. Yes.
Yes.
Okay.
But that doesn't mean the examiner didn't mark him. Probably the examiner will say, okay, fine. probably he will not lose any mark because of this. Okay?
I want to ask
what
you about
about
The next
what about dilating?
Dilating, yes, that's what I'm thinking. Muhammad just told me that the stimulator told him to use stretching. But look, it's not a big deal. Even though if the stimulator didn't accept it, the examiner is aware of that. And I don't think widening is a medical term. I don't think dilatation, I think dilatation is a medical term. Dilatation is a medical term. So widening or stretching, both of them are okay.
Okay.
But not dilatation. Dilatation is a medical term.
Okay, I want to ask question about the patient asked me for how long he stay in the hospital. When I ask or when I add this question or as this answer for this question.
Okay. This exam is not about the right or wrong answer. This exam is about being diplomatic. You shouldn't say 4 weeks or 6 weeks. You should tell him this will depend on your recovery. If you recover and you are safe to go home, we will send you home.
Yes.
If there were any complication, we will keep you.
No, I'm not mean that this my patient Sahar she forgot to ask me about staying in the hospital.
You know already
When I
the
can add this point. When
Okay.
I can add.
You can add it whenever you like. You can add it in the middle or at the end. Let's say you forgot to add it and you came to the end.
the
You
procedure,
can just
yes.
say, okay, I'm just letting you know, I'm just confirming for you that you don't need to stay in the hospital while you are waiting for your result.
Okay.
All right.
Okay. I got it. Thank you.
Najah? Okay, next.
Excuse me, Dr. Ali. Hello.
Yes, Muhammad.
I take a permission from you and Dr. Muhammad. I know that I think I'm the one before the last one to present.
Yes.
And as you know my situation, if I
All
can
right.
present now, because
Yes.
I'm talking to you now from ER. Yes.
All right.
Yeah.
You
Asia,
can present
Muhammad
now.
Kamal will come before you. All right? Asia.
Yeah, I just take permission from you all guys because I'm the
All
first
right.
and second on call. So
All right.
give me
It's
the
okay.
scenario and who's one with me?
You have splenic hematoma.
I will be the patient, no problem.
Okay. Just the same as the school or just
Same
straightforward?
as school. Same as school.
Same name and same everything.
Yes, surgical doctor, leaving hospital, right? I want to leave the hospital and you want to keep me in the hospital. Let's do this.
Okay. Good evening, Mr. Anderson. I am Dr. Kamal. I am one of the surgical. I am the doctor, one of the surgical doctor in charge today. I have come today to the hospital informed that you are about to leave the hospital for certain circumstances. Can I talk for you for a while?
Yes, doctor, that's fine.
Okay. First to start, do you know anything about your situation?
To be honest, not much, doctor. I'm just tired of being here. I just want to go. I don't know much.
Well, actually, sir, you have splenic hematoma, and in this situation, our hospital policy, you are not allowed to get out of hospital, say, for your health.
What is splenic hematoma, doctor?
Well, actually, this is a very serious situation. You have to be admitted under our vision here because we have to intervene for your situation.
Yeah, but I don't understand what is splenic hematoma like. What is this?
Spleen is one organ that in your body. It's in your tummy between your that lives in the side between your chest and your tummy, and this organ has many advantage. But if it is distracted or being hit by something, their blood will be collected in this organ, and we have to follow because it's a serious condition, and it's maybe fatal for you.
Okay. Even though it's fatal for me or whatever you're saying, doctor, my wife has a colon cancer, doctor, and I need to take care of her.
Yes, I'm so sorry about your situation, and I know that you're under pressure, but your health is paramount. We can arrange your health firstly, and after that, we can take the judge for your arrange support for your wife.
I'm not convinced, to be honest. I wanna support my wife and stay with her.
I know that it is so frustration for you, sir. But as I told you before, it's a very critical situation. You are in a very critical manner because of your disease.
I have also job interview, doctor. I'm guessing you're not gonna give me money, right? You will not feed my family. I wanna go and do this job interview, doctor.
Well, actually, your consideration, I know that this is a very genuine consideration, your job, but we can arrange your job management after we are finishing your situation, because as I told you before, it's a very critical disease as you got here. And your job, we can arrange with the job appointment for your case.
Will you give me a job then? Like, what are you talking about? I told you I'm going to my interview, like, and I need to leave for a job. How will you arrange for me?
After we get, sorry, after we finish from situation, we can discuss with the manager for your job, for the interview for you.
All right. I'm not convinced, doctor. I still want to leave. I don't want to stay here.
Well, according to our policy here, there is a confidential paper you have to fulfill it because you want to get outside of hospital. This is against medical advice. This is some kind of legal papers. You have to fulfill it, which is called discharge against medical advice. You have to sign it and fulfill it.
No, I will not sign nothing. I just want to leave.
Your health, I know that it's so frustration for you, and I do appreciate your situation. But please, you're gonna help us. We are all here for helping you. I know that
Yeah.
you are help and your wife, you are care about everyone, but we are all caring for you.
No, but okay, will you let me go without signing this paper, doctor? I want to leave and I don't want to sign nothing.
I'm so sorry, sir. This is the rules here in our hospital. We
Okay,
can-
so
of
all
course.
right, whatever. Give me that paper and I want to sign it and leave. I just want to get out of here.
Okay, you can sign the papers, but please, there is some advice I want to give it to you, please. Are you hearing me?
Yeah, please hurry up, doctor, please.
I want you to take care of yourself at home. Your situation have to be managed. I mean that if you feel some kind of disease, any short of breath, you feel you are so tired, you can't stand, your health is deteriorated, please call 999 and call your ambulance, and please come to us immediately.
All right. Okay, doctor. Can I go now?
And well, after you finish the paper, after you take all these advices, I wish you good.
Can you
I wish
bring the
success.
paper for me, please? I want to sign it and leave.
Sorry?
Can you bring the papers
Hello?
for me? I want to sign it and leave.
Can you what?
Bring the papers for me. I want to sign them and leave.
Yes, but paper is signed. Yes, I can take it. I will in charge the authority here. I can take the paper. Yes.
Okay, let bring it and I will sign it and I want to go. Okay, that's fine.
Okay, Mr. Anderson.
All right. Okay, doctor, you have 2 minutes and 40 seconds. Do you want to do anything?
Actually, nothing in my head. Sorry,
Yeah.
nothing in my head.
All right, fine. Okay, good. You can just summarize in the last 2 minutes. That's what you summarized already, but you can summarize again just to make sure you fulfilled your time.
Mr. Anderson had splenic hematoma, and he's
No,
admitted in our hospital.
Summarize to me. Summarize to me as a patient. I'm Mr. Anderson. Summarize
Okay,
to me.
okay, Mr. Anderson. Okay, let me summarize your situation. You were admitted in our hospital. You were diagnosed as splenic hematoma, and you want to get outside because you have special situation, your wife and your job prescription, your job interview, and we have fulfilled you. We have advised you not to go, but you want to go under your. You take your own decision, so you fulfill discharge against medical advice, these legal papers, and we explain for you your situation and give you advices because you're gonna follow up in your home. Whatever you feel dizzy, whatever you feel you are so tired, you are so drowsy, please come to us. Call 999 and please come to us. Call the ambulance. Come immediately. We are here for you and for your health.
Okay, good job, Muhammad. Good job. I think there's a couple
I am
of
so sorry.
things-
I am so sorry, Dr. Ali. I'm so sorry for my situation. That's why.
No. That's good presentation. I will let Muhammad first discuss, and then I will follow up after him. Muhammad?
Yes. There is a suggestion for me. You can call me Kamal and call Muhammad. So not to interview yourself.
Yes, Kamal. Muhammad Babikir.
Hello, Ali.
Yeah. I will let you start the discussion. What do you
Okay,
think?
Muhammad Kamal, he did very good. He answered all questions perfectly. But I think the 2 minutes remaining, he may ask you, could you please summarize to me what we have gone through? I think he
Yes.
summarized already
is-
to you.
Is this question written in the school? That's my question, because I revised it more than 10 times today. Even I'm trying to see
Not
what do you mean by
written,
this
not
question.
written, but you
That's
complete
why I
your
can't answer this.
conversation in 7 minutes. You have 2 minutes.
No, look,
I'm trying to see.
look, Muhammad.
Yes,
school
I'm
is-
here. I'm here.
Kamal, school is just an idea. What will happen in the exam? Your patient could ask you new question. Your patient could change the scenario. Your patient could get upset.
I know.
Yeah.
I know. That's why I'm here in the school. But
But
I'm trying
Yes.
to squeeze my brain more and more.
Muhammad
Yes,
Kamal,
yes.
I think Ali asked you several questions about what do you mean by splenic hematoma. You need to
Yes,
explain
that's why
this.
I wasn't understand what do you mean by this. Explaining or
Yes, you
what?
need to explain this term for the patient. What you mean by splenic
Okay,
hematoma?
that's why when he asked me 3 times,
Yes,
now I got the
which
message.
is
He want me to explain. Yes, I
yes,
didn't
which is-
understand what do you mean by question.
Yes.
Yeah.
He means that what you mean by hematoma and what you mean by spleen, which is collection of
Oh,
blood in the
yes,
capsule
yes.
of the spleen. And
Yes,
also in the
I'm trying to
scenario,
explain it. Yes.
in the scenario, they are dropping in his hemoglobin. So that
Yes,
makes the scenario more serious.
okay, I forget this.
Yes. Otherwise,
And-
we did very good.
I'm trying. You said show empathy and show respect
Yes.
to the patient.
No.
That's-
Your presentation is very good, Muhammad. To be honest,
Yes.
very, very good.
Please call Kamal, not Muhammad. Kamal, fix it.
Okay. Ali,
Yes.
can replay?
Yeah,
Anything?
I just wanna know, is there anyone in the group wanna add anything, or did we miss any question? Or
Just
Yeah,
one
if
notice.
you-
One
yeah,
notice, Dr.
if-
Ali. One notice. I will be with you. I will try, okay? But I will be silent.
Okay, that's fine. Yeah. All right.
Okay.
Even
I
you can close, even if you want to close your camera, that's fine if you want to be more comfortable.
I appreciate it, guys. Thank you so much for all of you.
All right.
Okay. May I ask something, Mr. Ali?
Yeah.
Is it obligatory to summarize everything at the end of the station? Because I remember that my previous exam, I failed all the time and I couldn't find the time to summarize.
Summarize will make you more professional. Summarize will give the examiner a feel that you have more time to summarize, which will give a good image. And believe me, on the exam, you will find a lot of time. If you memorize what you need to say, there will be 2 or 3 minutes silence. So in
Mhm.
this one, yeah, so practice in a way that you will have time to summarize. I will not say like, okay, this exam, they try to make it objective, right? They are doing their
Yeah.
best to make the exam objective by marks.
Yeah.
But believe me, at the end, this exam is subjective. If the examiner liked you, he will pass you. If the examiner thinks that you're good doctor, he will pass you. So this exam is not just like, and I will make a lecture about the stuff that you are not aware of, guys. How to dress, how to present yourself, how to smile. This exam is not just like a study. It has a lot of extra clinical stuff related to this exam.
Okay.
Okay? This one of
Yeah.
them. This one of them. Summarizing will make you appear to the examiner as a good doctor.
Yeah. Okay. And then what I would
And
like to add.
when they mark the exam, they mark it firstly with with objective numbers,
Mhm.
and
Mhm.
also they have subjective. They have 4 categories:
Mhm.
badly fail, barely pass,
Borderline.
borderline, and pass. So they give you marks when you ask about permission and consent, but they also their judgment is also has a weight for the exam. Okay, so summarize.
see.
Always summarize.
I see. And I want to add something. It's worthy to know that they'll provide you a pencil and a pen. And in such a station, it's better to illustrate for the patient by drawing.
Yes, yes, that's a good point. As Iman said at the start, you want to draw for me.
Spelling.
Yes, and I think Kamal didn't mention the drawing, but he can mention
Yes,
it.
that's why. Yes, I didn't mention the drawing. Yes.
And it's also not mentioned in the school, so we're gonna add it now to school that to.
Yes, I didn't mention.
Yes.
Yes, this is not in the school. Yes, and should I said I have to summarize this one? Add it.
The summarized is added. Yes.
Okay. Yes. Can you please add this other notes? Yes.
Yeah, all the notes. I'm doing that during the session.
Okay.
I can draw it
I
for
appreciate
you.
it.
Okay, that's fine.
Okay. The next station is with Asia. Asia, are you here?
Yes, I am.
Okay.
Iman,
be
can
the
you be the
patient?
patient?
I'm sorry. Can if it's applicable, can one of you be the patient and level up the station for me?
Sorry.
Can any one of you be the patient for me and level up the
Okay,
station
okay.
for me?
I can be the patient. Ali.
All right. Let me put the timer.
Okay.
So Iman is doing okay. Asia is doing what? Sorry, warfarin patient.
Hmm.
Warfarin patient, 5 counseling station. Where's the warfarin? Yes. Time. Okay, start.
Okay, good evening. I'm Dr. Asia. Okay, I'm sorry, what's the name of the patient?
Ali.
Choose whatever you like.
Okay, good evening, Mr. John. I'm Dr. Asia. I'm one of the surgical doctor working in this unit. I'm here to discuss with you your concern about stopping your warfarin pills. Please, can you tell me what exactly your concern about stopping this drug?
Okay, doctor. My doctor told me that I should not stop it because stopping warfarin will threaten my life. You know,
Yeah,
I have
okay.
cardiac surgery.
Yes. Okay, I understand this totally. Do you know exactly why they gave you this drug from the first time?
Yes.
Yeah.
He told me that warfarin will do something in my blood and prevent clot. And if I stop it, it will threaten my life.
Yes. Actually, yeah, you know very well. Actually, yes, it's a blood thinner. That's what we call it. It's prevent. It's right that it's prevent your body from getting clots here and there. And yeah, it's accurate with your situation. Okay, but you know that I need to assure you that your health and your safety is our priority. We are not going to risk to put you.
So why you need to
vulnerable.
stop warfarin?
Yes, I'm going to take this step by step with you. We are not going to stop warfarin to just leave your blood without any blood thinner. We are going to substitute warfarin with another drug, which we call it heparin. Okay? Are you following me?
Yes, I'm following you.
Okay. So why we are doing this? Yeah.
Yes,
Yeah,
why
please.
you wanted to instead warfarin by heparin?
Yeah. Okay. That's a good question. Because you know, when you are inside the operation, there are going to be some wounds and some cutting, and we're not going to risk you bleeding there. And having a much blood thinner in your blood can have a risk of you bleeding. And warfarin, if we stop warfarin before your operation, it's going to remain in your blood. It's not going to go easily from your blood. But when we use warfarin actually, heparin, I'm sorry, actually stay for a longer period in your blood, only for 12 hours. So that's why we're going to substitute warfarin with heparin. So we don't have to have this period where you are off blood
Okay,
thinner.
I get the point, doctor. But
Yeah, okay.
I am asking about the difference between heparin and
Yes.
warfarin. Is the same action?
Yes,
It will
yes,
prevent
it's
clotting?
give you the same. Yes, give you the same effect, definitely. It's has the same effect. It's prevent clot formation, but I just like I just mentioned, it's a matter of a risk of bleeding intraoperatively or inside the operation, and that the warfarin we cannot stop it like in a short period before the operation. We have to stop it a long period before the operation in order to get rid of all of the warfarin from your blood.
Okay.
And we do not want to risk putting you off blood thinner at all.
Okay. And when can I resume my warfarin?
You can resume your warfarin after you wake up from your operation. You are we test for no. I cannot give you hour because I cannot tell you exact hour when you will be fully awake after the operation and fully safe of bleeding. This is depend on your body reaction toward the operation. That's why I cannot give you hour. But I'm telling you, whenever you are fully healthy and fully able to go back to warfarin, we are going to put you back to warfarin.
Okay. Is it necessary to stay in the hospital before the operation?
Actually, no. There is no exact need for that. If you are able to inject yourself, you can inject yourself with heparin.
I live alone, doctor. I can't.
Yeah, you are going to be in a follow-up with a anticoagulation unit. They are going to do some investigation for you in order to optimize the range of blood, and also they are going to instruct you about the doses and everything.
I can't do it alone, doctor.
If you cannot, yeah, okay, I understand. Some people cannot inject themselves. We can contact the social worker, and he can arrange with some nurse to do this. But if there is no capability of all of this, so you have to stay with hospital with us for maybe a 5 days period of surgery.
Okay. You wrote the note about my anti-anxiety medication.
Yes, you are
taking. Do I need to stop
this is completely no. This is completely safe. You don't have to stop it. You can have your dose the day of the operation with only a sip of water.
Okay.
I'm so sorry. I'm so sorry for the noise.
All right.
Okay.
I'm so sorry. Yes. Yeah.
All right.
Okay. Are you following me?
Yeah, doctor.
Okay. Do you have any further questions?
No.
All right. Can you tell me exactly what did you get out of the point I've mentioned?
You told me that I need to stop my warfarin, and
yes,
you will give me another drug which is called something heparin.
Heparin, yes.
And which will give me would prevent me from clotting, and I appreciate that.
Yes, yes, yeah. Actually, that's exactly what I've been talking about. We're here to only save you and put you out of risk. So this is exactly the point. We're going to substitute your warfarin with heparin. We're going to take you back to warfarin after the operation. Okay?
Okay, doctor.
Okay. If you have any other worries, I'm going to leave my contact number with the nurse. You can contact me at any time. I'm here to help you, okay?
Thank you, doctor.
Thank you very much.
All right, you still have 2 minutes, which is good. Very good presentation, Atia. Yeah, good presentation. You answered all the question right, except one question. I think you didn't understand him.
What's the question?
When he asked you, do I need to stay in the hospital before the operation?
Yes, this is something that I think I found it somewhere. They say that this is the new. You have to, the patient don't have to stay in the hospital. But I'm not sure that should I follow this or not.
Okay.
Here to ask you.
So let's say
It depends on.
No. Okay, I'm practicing now here. We have a patient who's on warfarin. All right.
Yes.
Ask you about the bridging, right, Muhammad?
About what?
Is it necessary to stay in the hospital before the operation?
Yes.
That's what he asked you, right?
Oh,
Yes,
he
I
asked in general or because of the substitution?
No. In this
He asked-
situation before the operation, you told me that I
Yes,
need to
I
stop
answered
warfarin.
that
Yes.
he don't have if he can inject himself and follow up with the anticoagulation unit.
Yeah.
But if he's not capable of doing this, he has to stay in the hospital.
All right. When we give heparin, what do we need to check for? Iman.
Yes.
For Asia.
Yes, we have to check to do some blood investigation.
Well, specifically what?
The heparin, it's going to be the
Basic
PTT.
pathway, PTT.
ABTT, right?
Yes, it's intrinsic.
How can he do the ABTT at his home?
No, as I told him, that's the
Yeah.
anticoagulation unit are going to run some blood test for him in order to optimize the range in his blood. I mentioned this.
All right. If you are giving a patient ABTT, do you know you need to take every how long? Do you know that? Let's say I want to take heparin. All right. How many times per day I need to check my
Per day?
ABTT?
It's per day?
Sorry?
I don't know. It's several times a day. I thought maybe daily.
Yes, it's 4 times a day. Every 4 to 6 hours. So it doesn't make sense to send him home.
Yeah. Okay. So yes.
Yeah,
Now
it doesn't make sense to send him home just to be on heparin. You need to check his ABTT and you need to check his warfarin. That's why he needs to stay in the hospital for the 5 days.
Yes. Okay.
Yeah, so that question, be careful with it.
Yes, Ali, in my
Yes.
exam also, I hear like Asia, some updating by these questions, about this question,
Yeah.
which is, if you are able to stay, to go to your home and you have a nurse to check and give, it will be. But you answer me, you need to check heparin every 4 hours. So
Yes.
the answer about he must need to stay in the hospital is the accurate answer.
Yes.
Okay.
And look,
Yes. Okay.
we call it here district nurse. And I want everyone to remember, right, this district nurse. The district nurse is the nurse who gives the medication at home. But there is no district nurse that will come to the home 4 times a day or 6 times a day to check the heparin.
Yes.
Usually, the district nurse will come twice maximum a day. All right?
Yeah.
I
Okay.
know there's a lot of material circulating outside,
Yes.
but this from people didn't practice in UK, by the way, and they don't know the system. 6 or 4 to 6, and when you do the ABTT, you need to correct the heparin. Okay? And even you may need to give heparin infusion. So according to I will take the ABTT now, and I will take it after 4 hours. And according to the reading, I will increase or decrease my heparin. So the answer, I will keep him in the hospital for 5 days to check. That's the logic, to give the examiner that you understand, to check the ABTT and to give the time for warfarin withdrawal and to make sure there's no any problem of serious bleeding. All right?
Okay. All right. Thank you.
That's why, Asia,
Okay.
that's why I'm saying don't study from any other material beside our material.
Okay.
Because if you answer this question on the exam and you had a vascular consultant or someone who knows what he's doing, believe me, he will fail you on this.
Mhm. Okay.
All right?
Go to. Oh yeah. Yeah.
Okay.
The next question about appendicitis.
All right.
Alia,
Okay.
are you ready?
Yes.
Who will be the patient?
Uh,
Anyone?
Asia or Iman?
For me, it's going to be difficult a little bit.
All right.
Yeah.
Who
I'm
else?
sorry.
Let me check the group. Sahar? Hajar. Okay, Hajar then. Hajar can be the patient.
Thank you, Haji.
Okay.
Let me put the timer. Okay, start.
Can I know the name of the patient, of the
Call him
mother, father?
as you
Miss
like.
Anna,
Yeah, as you like.
Miss Anna.
What?
The mother
Miss
of the
Anna.
patient is Anna.
Okay.
Start.
Hello.
Someone has a noisy background. Muhammad, is it you? If you are not talking, you can mute yourself. Yeah, start.
Hello, Miss Anna.
Hello.
Hello. I'm Dr. Alia Musa, one of the surgical doctors working here. Can I talk with you about your child condition?
Yes, please.
Okay. First, let me know, what do you know so far about her condition?
I don't know a lot. I was very far from my daughter. I had to work for long hours.
Mrs. Anna, don't feel guilty. This condition will happen to anyone. Your daughter brought to hospital with your neighbor, complaining of tummy pain. And initial investigation suspected acute appendicitis. And she was managed with our one surgical doctors, given intravenous fluid and antibiotic. And now we are waiting for the consultant to operate.
Are you sure it's an acute appendicitis?
Okay, Miss Anna. According to her sign and symptom and investigation we done, there's highly suspected acute appendicitis, but we can confirm only after the operation.
I see. Is it dangerous?
Okay. In children, there's less fat inside their tummy. So, as this appendicitis make particularly serious. But I want to reassure you, the only experienced and skilled surgeon who's the one allowed to perform as such operation.
Will the wound be disfiguring?
This is nice question from your side. The small horizontal wound will leave a small scar, but if we need to extend more, this will actually make a disfiguring scar.
Are there any problems could occur?
Also, this is another nice question. Actually, severe infection will block the reproductive tube in such a age, okay, and may lead to future infertility.
That means my daughter could not get pregnant in the future?
Miss Annie, don't worry. She have another working tube in the other side, okay? And also, I'm not saying she will not, she will be infertile. I'm saying that there's possibility of infertility. So that is mean there's difficulty in getting pregnancy. Okay?
Okay, I get you, but my husband have done such operation and he died. Done by
Oh.
Mr. Lee. He just died.
Oh,
I'm afraid.
I'm sorry. I'm sorry. I'm really sorry for that. Can I ask when and how he died?
He died a few weeks after the operation at my home.
And what he have?
He had
Can
a
I know?
colon cancer.
I'm really sorry for that again. Those are two different situations, Miss Annie. Okay? I think that the cause of your husband died is cancer, not the operation. Okay? And Mr. Lee is one of the best surgeons you have in this hospital.
Okay, I see. Can I see my daughter?
Of course. But first, let me check and I can arrange it for you. Okay?
Thank you.
Okay. You have any other question?
No, thank you. I just want to see my daughter.
Yeah, okay, so let us summarize. Your daughter brought to hospital and she had acute appendicitis and we're waiting for the consultant to operate. And I discussed with you the benefit and the risk of the operation. Okay, Miss Annie, you have to know that we are here to help you and support you. If you have any question, don't hesitate. Ask me. I will leave my contact number with the net. Okay?
Thank you very much.
Thank you. Thank you for your cooperation.
Good. You still have 4 time. Good, Alia. That's
Thank
very
you.
good presentation. Just a couple of mistakes that are very minor. What he have, that's wrong. What he had, you are talking about past tense, not but.
Okay.
You said tummy and belly. You didn't say abdomen, which is very good. I noticed in school it was abdomen and I changed it to belly. That's very good. So it has to be belly. Don't use abdomen in communication skills.
Okay.
When you ask her what was the cause, I don't think you asked her this way. You asked her what did he have, right? Or I don't know how. Yeah, she told Hajar told you her husband died because of Mr. Lee. You need to ask her what did he have or what was the cause. All right. At the end, you ask her, you have any question? You should say, do you have? Do you have any question? Do you have any?
Do you have? Okay.
Do you have? Yeah, a grammatical mistake are very crucial. Why? Because probably the communication skill person, you have a doctor and you have someone who will just listen to you and read your body language. Probably the second one will be native speaker, so he will notice this mistake.
Yes.
But I don't think you missed any question. You were very coherent. You finished within the time. You answered every single question right. Muhammad, did we forget any question or does anyone have any new questions that we need to update to school?
I have a point about Alia. First of all, you did very good. But when the patient asks you, is it dangerous? I think you said because child there is less fat inside his tummy. Did you mention perforation or any cutting through his tummy? Perforation, I mean.
I didn't mention this.
You
because
mentioned
I
there is a
don't
less
know.
fat.
They can have just acute appendicitis or complicated perforated already.
Is ruptured appendicitis.
If ruptured, I have to mention
Yes.
perforation is serious.
Yeah, it's the ruptured appendicitis.
Okay.
Okay.
And Muhammad, I think
Otherwise, it is very good.
Perforation is a medical term, right? We should
No,
use the
English language.
perforation.
Yeah.
Let me just confirm that. Give me a second.
With English language, we can use it in medical terms.
Intestinal perforation defined as all right. There's so many words that you can use as medical or as layman.
Okay.
But just just to make it clear, use rupture better than perforation. Rupture
Okay.
is for sure is like it's not a medical term. Use rupture instead of perforation. Okay.
Okay.
Yeah, use rupture. Less fat inside the belly make rupture. I'm just gonna update it on school. Rupture particularly dangerous. All right.
Think
We
we finish
finished.
for all stations.
Yes, good job.
May I
Thank you,
ask-
everyone.
may I add something, please?
Yes.
Okay, fine.
Yes, Muhammad.
Actually, was my station on my previous exam.
All
And I
right.
have 2 points. I want to add to some things. First of all,
Okay.
the patient was very anxious, was very frustrated. When I opened the door and get inside the exam room, she jumped on me and where is my baby? Exactly, that's what happened inside my exam. So you have to be calm, and one of my mistake that I got anxious also. So I think we have to absorb the patient anger for this. And the other thing I want to add, they surprised us in our examination and put a preparatory station before this. Same like phone call, and they provide the file with the data, and they mentioned that they transfuse blood to the patient. So this is one of their tricks.
What about what is the station that mentioned transfusion?
This one. You're talking about the appendicitis, right?
Yeah.
Yeah. So I'm sure we didn't explain enough how the exam will be conducted, because we assume everyone here knows how the exam will be conducted. You will enter a room, as Muhammad just said, and in the room, it's going to be empty room. You will have 9 minutes. You will have file, investigations, and a lot of paper to read through. You will take notes, and then you will go to the next station. They call this preparatory station. So you have 9 minutes, you have a station before your station with the examiner. You will have this in the communication skill in person, and you will have it also with the phone call. So you will have 9 minutes to extract as much as information as you can.
Yeah, I just, Mr. Ali, to clarify more about conducting such issue in person-to-person